Today I will be discussing about the differences between a keloid and a hypertrophic scar. It is one of the most common questions asked in theory exams and also maybe asked in Vivas. So hypertrophic scar by definition is an excessive scar which is confined within the original margins of the wound, whereas a keloid scar is a scar which extends beyond the original wound margins. Talking about the collagen, mainly type 3 collagen is there in hypertrophic scar, whereas type 1 and 3 both type of collagen is found disorganized in a keloid scar. About the collagen arrangement, in hypertrophic scar, parallel to epidermal surface it is present, and in keloid scar collagen arrangement is haphazard and disorganized. The cellularity consists of abundant myofibroblasts in hypertrophic scar, and there is hypocellular collagen bundles in a keloid scar. Talking about the growth pattern, the hypertrophic scar is usually elevated but remains within the wound borders, whereas in keloid scar it grows beyond the wound edges and causes an appearance of crab claw. The common sites where a hypertrophic scar is generally seen is in the areas of tension like flexor surfaces of the body, and keloid can also be present over earlobes apart from sternum, shoulder and jawline. Incidence of hypertrophic scar is more common, that is 5 to 15%, whereas it is less common in case of keloid. Etiology, it happens where there is increased wound tension, whereas in keloid it is genetic and also endocrine influence driven. Age group, any age may have a hypertrophic scar, but talking about keloids, it is very rare in newborn and elderly. Relation to injury, it is often seen after a superficial or a moderate injury, but in case of keloid it is usually seen after a deep injury. Natural history, it may regress with time, whereas keloids doesn't regress spontaneously. Recurrence rate is very low in case of hypertrophic scar and it is high in keloid. Response to any treatment is better with hypertrophic scar, whereas it is resistant in keloids. Symptoms include pruritus and possible pain in hypertrophic scar, whereas it is more pruritic, more painful, cosmetically distorted. When we see the histology, there can be parallel collagen fibers, whereas a keloid consists of thick eosinophilic collagen bundles. Treatment outcome is good with therapy, and in case of keloid, it requires multimodality treatment. The next video will be about keloid treatment and the mode of action of each treatment method. Thank you.